Wabanabiekna, wabanabiekna, mega de sespela madiek, Bukula de Muja, wabanabiek.
What is Tajikeimik?
It really probably began way back in 2012 when we saw BC take those steps toward health transformation and self-determination. We really thought it was very important for us to go out to community, to really have them understand what Tajikeimik is or what Tajikeimik was trying to do. So we had a large Mawiomi where we brought together leadership, community members, health centers, Grand Council, like we bring a lot of people together. And then we did a kickoff session for a large Mawiomi. And then we informed the communities at that time that we were going to visit each and every community. They shared so many personal stories and personal experiences that many were heartbreaking, really and truly. You know, hearing the stories and the bad experiences that people have been enduring while trying to access health care.
And to add to that, you know, from a community perspective, many community members were very grateful to be involved in that process, you know, in that engagement process, to be able to inform, you know, what the brand new Mi'kmaq Health and Wellness Authority is going to be and what it's going to look like. And, you know, to Sharon's point, we did hear a lot of stories that were heartbreaking. And, you know, now we are actually going to take those, you know, those words and those experiences and develop them into positive action and to develop them in ways that, you know, we could now create a new system that works for us.
My vision is big, and I do see how we can really work toward building up our capacities and building up our services and building up our nation.
With Tajikeimik, for our viewers who don't speak Mi'kmaq, what does Tajikeimik mean? Where did the name come from, and why was that one selected?
It was a process we went through. We met with the health directors, we met with leadership, we brought representatives from Grand Council, I think were involved as well, and language experts, you know, in our community, come together and strategize, you know, what could we find? What does it mean? And we talked about what does it mean to be healthy for our nation? And that's really what we are looking for, is how our nation could become a vibrant, healthy community. And Tajikeimik translates into being healthy. So we know that the word Daji had been used for many, many years by our traditional midwives, and that term was regularly used in our communities, that Daji was the midwife that went and provided services. So it's a common term that was known to many of our elders in our communities, but we also now understood the translation that it was really connected to health, and Tajikeimik was about, you know, about how we could become a healthy, vibrant nation.
I did not know that. That's amazing. The other thing I'm wondering is, and either of you are welcome to answer this question, and so when Tajikeimik is officially up and running and we have full control of our health in our communities, in this part of Mi'kma'ki, how do you see that envision in helping you, especially as a health director, in the delivery of program and services directly in our communities for our people?
You know, when I started, Tajikeimik was already operating, and you know, it already began. So I was fortunate to come into the role where that already existed. So I remember coming into the role, and you know, all the health directors were already meeting regularly through Tajikeimik to plan and strategize how to better the health of, you know, Nova Scotia. And that table allowed us to, you know, be able to advocate provincially and federally, you know, on our health, and to discuss ways on how we could work together? How can we better our health? And I know we're still in the process of becoming incorporated, but I mean, there has been a lot of work that already been done to date. That includes like the Mi'kmaq Client Linkage Registry, Baby Smiles Initiative, and things like that we could, promote the health for our community. And as we continue to move forward, we meet regularly, and we're, constantly trying to look for ways and initiatives and innovations on, how can we better it today.
The other component too is that all of the services and programs that have been provided through the federal government were very prescriptive. We knew that the programs that were being developed didn't really meet our needs, and nor did it meet our cultural needs either, So there really is very little support to support specific cultural changes within those programs. And so we've heard from community the need to incorporate more culture and language into our day-to-day programming that we have in community around health.
And we are led by Tuaitsi Edu Optimum, which means, bringing the traditional and Western knowledge, bringing them together for the betterment of our health system, of our, bringing those two worldviews together. Because as we're sitting at the table, we understand, we have strengths, and I understand, the Western system has strengths. So how can we better work together in terms of, bettering the health of our community? So as Sharon was speaking regarding the Early Years program, that, that program specifically is running in Eskasoni, and, there's been a lot of success because there's early years visitors who are, fluent in the language, that also, they're incorporating the culture and knowledge, and while they're visiting the moms, working closely with their nurse, the family physician. So it's really, bringing those two worldviews together. And I think that wouldn't be possible without Tajikeimik. We would have had to follow, what the federal government says, what's the best way for a maternal child health visitor, but having Tajikeimik allows us to incorporate what works best for us and best for Mi'kmaq of Nova Scotia.
We're establishing a new health organization, and we're going to need to focus on health human resources, but we also need to build up those capacities in other areas and hire from many other professions across the board.
Did you know that the Mi'kmaq education in Nova Scotia isn't governed by the Indian Act nor by the Provincial Department of Education? It's governed by the Mi'kmaq themselves through Mi'kmaq Ginatmoy via the Mi'kmaq Education Act, which advocates, represents member communities' educational interests and Mi'kmaq language rights. 2 Mi'kmaq Education Acts were passed, one federal and one provincial, to vacate the field for the Mi'kmaq. Earlier, we were talking about taking control of our education. So here in Nova Scotia, we have Mi'kmaq Ginatmoy, and I went to both an Indian day school and then subsequently a Mi'kmaq Ginatmoy school. And I remember since I graduated from high school, one of the measures of success has been number of high school graduates we have, number of university graduates we have, number of graduates from professional schools, graduate schools, etc. So to me, that's like a defined success, a part of the success that Mi'kmaq Ginatmoy lays out. So with Tajikeimik, what is the end goal? What does the success look like?
I went through the Mi'kmaq Immersion School in Eskasoni. And it was actually the first time when the immersion school was developed. It was in year 2000. And I find going into that school, my parents took me on my first day, but I felt very warm and welcome because I'm fluent in Mi'kmaq. And so to be able to go into the school at such a young age, and my teachers are speaking Mi'kmaq and they're honoring my culture and traditions, to me, I felt like, I was home. And, putting that on the health level, if we could have more Mi'kmaq speaking doctors, if we can have more Mi'kmaq speaking nurses and more Mi'kmaq nurses, I feel that it's just so empowering for, you know, a patient to walk in and they're already understood. They don't have to, you know, tell their story another time, because they already understand, you know, where they're coming from, their traumas, you know, what has happened to them. Because a lot of times, many of our First Nation communities, we share a lot of the same experiences, Indian day schools, residential schools, and that has, you know, been legislated by the government, and we've developed those traumas. So I feel, you know, as we develop in that model, it's going to be very empowering.
There is racism in our province of Nova Scotia, and especially in the healthcare system. And we've witnessed that. We as family have witnessed that, as Mi'kmaq people, from all communities. Cape Breton communities came together and funded it independently without any resources to hire a hospital support person to work with our community members who were being admitted into hospital. Luckily, we've been able to secure some additional resources to expand that role. Also, we were able to work collaboratively with the province of Nova Scotia and the Nova Scotia Health Authority to hire, they're hiring in Mi'kmaq Indigenous navigators and they will provide the clinical support, whereas our hospital support coordinators are going to provide more cultural support and connect to community, and the navigators will have more of a clinical role. We recently brought students together at our recent Maui gathering, and we heard firsthand from several Mi'kmaq students on what their experiences are and their need to connect back to community, and the need to connect back to family, and the need to connect with their culture while they're in these cities, you know, getting their education and going through those processes. So we have worked collaboratively with the province, and are working on a Olnu nursing strategy. And our Olnu nursing strategy really will be focusing on providing those supports to students who are in the nursing stream. We know that universities like Unama'ki College has done a great work already in supporting our students from Cape Breton or Unama'ki, but you know, we see those gaps in the larger universities as well, where they don't necessarily have the connections or the support, you know, and it's very minimal, I guess.
And now, you know, we're in a different time where now we are seeing more Mi'kmaq students now going into medical school, dentistry, and really that to me is so empowering for our communities, and you know, it's very uplifting, and I really hope as we continue to move forward that we see more going into those type of professions, and nursing, and you know, all of the health professions right across.
What would Tajikeimik's long-term goal success look like to you?
Our long-term goal is for a healthy, vibrant population. We are the fastest growing population here in Nova Scotia, you know, so we do have a young population and a growing population. So I think that, you know, ideally, yes, 100%, we want to see more Mi'kmaq students graduate from various professions, health professions and other professions, so that they'll be able to provide the services that we need to our people. You know, hearing from every student that I've ever spoken to, I often hear them say, I want to do this and complete my university and go to school, and so I can come back and help my community. That is the most common phrase I hear from every student that is in university and in school, that they're doing this work to come back to help our people. And so I think having that goal is a goal for Tajikeimik, but it's a goal for our nation as well. You know, I think that there's a lot of work to be done, and a lot of capacity has to be built. You know, I think that services need to be brought closer to our communities, rather than us having to go out and face racism and access services that are not appropriate for us.
What about our elders?
So in Eskizoni, we've actually just opened a brand new long-term care facility, and it's called Gigino, which means our home. And it's open to all Mi'kmaq communities right across the province, where now, our communities have a home, a long-term care facility that's operated in a First Nation reserve, and that's Eskizoni. And that work was very collaborative, working with health directors, working with Tajikeimik, working with the province, working with Eskizoni on how we could provide culturally support care to our community members. So a lot of the staff now are Mi'kmaq, and they're also fluent Mi'kmaq speakers. So a lot of the community members that are now coming into the home, they're also fluent speakers. So to be able to provide that care, again, with the culture and with the language, is very meaningful to our community members.
Did you know that the Mi'kmaq population drastically went down in about 200 years? The original Mi'kmaq population was estimated at about 200,000 minimum. And near the mid-1800s, the population was as low as 1,500. Joseph Howe, condemning the colonial government for permitting poverty among the Mi'kmaq people to exist, estimated that the Mi'kmaq would be extinct in about 40 years if nothing was done. He was an advocate, an ally, and a supporter for the Mi'kmaq.
So with Tajikeimik, you have been producing some materials already in the promotion of health, and one example would be oral health. Could you share a little bit about that with us?
Yeah, definitely. So there was a project that was started through the health directors, and it actually started prior to my time. I actually came in and it was, in development. But the purpose of that project was, looking at the research that we had, where when we looked at oral health, we, seen that there was a lot of oral health issues in our communities. And so we wanted to put it into action and say, how can we better the health? How can we better oral health in our community? So one idea that was thought of is a book for our young population. And this is the Baby Smiles book, and it's in Mi'kmaq, Wesquowigas at Mijuajij. And it talks about the importance of oral health and the importance of, how our children could, develop better healthy lifestyles in terms of oral health. So this book is now available province-wide in our Mi'kmaq communities, and what oftentimes is in our community anyway, we do deliver these books at well baby checks, and when children come and get their immunizations, we give them a book. It's also available in our schools.
The 5 Cape Breton health directors came together, came up and worked with the School of Dentistry at Dalhousie as well. We partnered with them as well, and they guided us with all of the expertise around the recommendations that come with the book as a resource. But we then came up with a storyline, and we've never done this before. We never wrote a book before, and so it was a big learning curve. But we ended up contacting Loretta Gould to do the artwork for us, and she's from your community, and and we worked with community members around the translation of the book. And we also have it available on the Tajikeimik website, and it's available to download for free. It's available, you can hear it in Mi'kmaq and English. And that's also to support and build our language capacity at a very young age. We've received multiple requests right across the country and beyond Canada, looking for translations in other languages.
That is amazing. I did not know about that.
Yes. I think that's something that's really important for us to learn too, is the importance of research in our communities that's led by our communities. Indigenous-led research or Mi'kmaq-led research really led us to, we knew that there was issues with oral health, but when you see the data and you see the facts that come out of that work, we really thought, we need to look at some type of initiative that could help parents, guide them in the care of their children. That is a great example of how we put research into action. And we've also realized that we would share our stories, but now we have real data to support our stories. And that is what provincial governments or federal governments listen to, is when they see the hard data along with the stories to support any kind of initiatives that we are wanting to build on or enhance in our communities. So we're continuing to do work on that. We're also looking at the development of a puppet to go along with the book as well, that can be distributed and utilized in our Head Start programs or our Mommy and Me programs or even with our dental therapy program.
How would you like to ever see our medicines being used with respect to Tajikeimik healthcare services and providers here in our territory?
We also believe that it was important to incorporate our culture and our language into all of the health programs and services that we are currently providing, but also to revitalize our traditional practices. Within the early years program that we recently developed, we've really incorporated traditional Mi'kmaq ceremony into those practices. Those ceremonies have been lost, and so we think it's really important to bring back those ceremonies to families at a very young age, so that the knowledge is there from with the children, with the parents, with the family, and so we're really trying to incorporate our culture, our values, our language into every aspect of health and the way we provide service.
So as Sharon was speaking regarding the early years program, that program specifically is running in Eskasoni, and there's been a lot of success because there's early years visitors who are fluent in the language, that also they're incorporating the culture and knowledge, and while they're visiting the moms, working closely with their nurse, the family physician. So it's really bringing those two worldviews together, and I think that wouldn't be possible without Tajikeimik.
From early childhood education right up to being an elder, language, culture being so integral to our part. It sounds like just incredible and exciting things for the future of Tajikeimik. And I want to say thank you both.
Well, Jarvis. Thank you, Jarvis.
Wabanabiyekna mega de sespela madiek Bukula de muja wabanabiyek Bukula de muja wabanabiyek Bukula de muja wabanabiyek Bukula de muja wabanabiyek Bukula de muja samwayek Bukte wicha wabasamwayek Bukula de muja wabasamwayek Wabanabiyek